The C-SPAN networks bring you long-form public affairs programming from the nation's capital and are a public service of your television provider. C-SPAN, created by cable.
Dr. Price, welcome to the committee.
Thank you, Mr. Chairman. Chairman Alexander, Ranking Member Murray, and all the members of the committee, I want to thank you all for the opportunity to speak with you today and engage in, as the Ranking Member said, in the discussion about the road ahead for our great nation. I want to thank Senator Johnny Isakson for his generous introduction. As he said, we've known each other for 30 years, and I'm so grateful for his friendship and his kindness. And our state is blessed to have had his service and his leadership. I wish also to especially thank my wife, Betty, of 33 years, who joins me here today. As Johnny mentioned, her support and encouragement and advice, which I would suggest to you is virtually always correct, and her love means more to me than I could ever say. Over the past few weeks, I've met with many of you individually and have gained a real appreciation for the passion that you have for the Department of Health and Human Services. Please know that I share that passion. That's why I'm here today and why I'm honored to be the nominee for Secretary of Health and Human Services. We all come to public service in our own unique ways that inform who we are and why we serve. My first professional calling was to care for patients. That experience as a physician and later as a legislator has provided a holistic view of the complex interactions that take place every day across our communities. And today I hope to share with you how my experience has helped shape me and my understanding and appreciation for the work of the Department of Health and Human Services. From an early age, I had an interest in medicine. My earliest memories are of growing up on a farm in the state of Michigan. We lived on a farm in Michigan before we moved to suburban Detroit when I was 5 years old. I spent most of my formative years being raised by a single mom. Some of my fondest memories are spending time with my grandfather, who was a physician. When I was young, I would be able to go on, spend some weekends with him, and we'd go on rounds, which at that time meant going on house calls. And so we'd drive up to houses, and the memories that I have of individuals opening the door and giving him a hug and welcoming him graciously are cemented in my mind. After graduating from medical school from the University of Michigan, I moved to Atlanta, which I've called home for nearly 40 years. It's where I met my wife, where we raised our son. I did my residency at Emory University and Grady Memorial Hospital, where I would later return in my career to serve as the medical director of the orthopedic clinic. Throughout my professional career, I've treated patients in all walks of life, including so many children. And anyone who's ever treated a child knows the remarkable joy that you have when you're able to go tell the mom and dad that we have helped. We've helped save an individual, save their child, or help their child back to healthfulness. My memories of Grady are filled with the gracious comments of parents and of patients for the team of healthcare specialists with whom I had the privilege of working. After 25 years of school and training, I started a solo orthopedic practice. Over the years, this practice grew, as Senator Isakson mentioned, and eventually became one of the largest non-academic orthopedic groups in the country, for which I would eventually serve as chairman of the board. During 20 years as a practicing physician, I've learned a good bit about not just treating patients, but about the broader healthcare system and where it intersects with government. A couple of vivid memories stand out. One, many of my patients were never more irritated or angry when they recognized that there was somebody else in the exam room, not physically, but figuratively, who was getting between the doctor and the patient in making decisions, whether it was the insurance company or government. And then there was the day when I noticed in my office, it was in the mid-90s, when I realized that there were more individuals behind the door where the clinical work was going on seeing patients than there were in front of the door. And those folks were filling out forms and making certain that we were checking all the boxes and either challenging or arguing with insurance companies or government about what was in the best interest of the patient. And it became clear to me that our healthcare system was losing focus on its #1 priority, and that is the patient. As a result, I felt compelled to broaden my role in public service and help solve the issues harming the delivery of medicine, and so I ran for the Georgia State Senate. I found the State Senate in Georgia to be often remarkably bipartisan and that collegial relationships were the norm. This is the environment in which I learned to legislate, reaching across the aisle to get work done. In Congress, I've been fortunate as well to be part of collaborations that broke through party lines to solve problems. Just this past Congress, it was a bipartisan effort that succeeded in ridding Medicare of a broken physician payment system, and which has now begun the creation of a new system which, if implemented properly, will help ensure that seniors have better access to higher quality care. So if confirmed, my obligation will be to carry to the Department of Health and Human Services both an appreciation for bipartisan team-driven policymaking and what has been a lifetime commitment to improving the health and well-being of the American people. That commitment extends to what I call the 6 principles of health care: affordability, accessibility, quality, responsiveness, innovation, and choices. But Health and Human Services is more than health care. There are real heroes at this department doing incredible work to keep our food safe, to develop new drugs and treatment options, driven by scientists conducting truly remarkable research. There are heroes among the talented, dedicated men and women working to provide critical social services, helping families, and particularly children, have a higher quality of living and the opportunity to rise up and achieve their American dream. The role of Health and Human Services in improving lives means it must carry out its responsibilities with compassion. It also must be efficient and effective and accountable, as well as willing to work with those in communities already doing incredible work on behalf of their citizens. Across the spectrum of issues and services that this department handles, there endures a promise that has been made to the American people. We must strengthen our resolve to keep the promises our society has made to our senior citizens and to those who are most in need of care and support. That means saving and strengthening and securing Medicare for today's beneficiaries and future generations. It means ensuring that our nation's Medicaid population has access to the highest quality care. It means maintaining and expanding America's leading role in medical innovation and the treatment and eradication of disease. I share your passion for these issues, having spent my life in service to them. And yet there's no doubt that we don't all agree on or share the same point of view when it comes to addressing every one of these issues. Our approaches to policies may differ, but surely, there exists a common commitment to public service and to compassion for those that we serve. We all hope that we can help improve the lives of the American people, to help heal individuals and whole communities. So with a healthy dose of humility and an appreciation for the scope of the challenges before us, with your assistance and with God's will, we can make it happen. And I look forward to working with you to do just that. Mr. Chairman, I thank you for the opportunity to be with you today.
Thank you, Dr. Price.